everyone, welcome to my channel K7 Therapies. My name is Kirti. So in today's video we're going to discuss about attention deficit hyperactivity disorder. To be specific, in that condition we will be discussing about the basic features and the symptoms that a child suffering from ADHD show. So there is a brief checklist based upon the basic features of attention deficit hyperactivity disorder. So if anyone of you requires that checklist, that complete PDF form, you can just mention it in the comments below, or you can just message me on my Instagram page. I will just put the name here, which is K7 Therapies. And if you have any query regarding that, you can just mail me, message me on Instagram, or just mention it in the comments below. And also, before beginning the video, if you are new to the channel, please subscribe to it and share the videos if you like it. So let's begin with the video. So here in the ADHD checklist, the basic divisions are hyperactivity is there, then there is non-compliance, there is impulsivity, there is underactivity, there is hyperactivity. There are classifications under emotional regulations and dealing with the family and the peer group. So to begin with, I will be very general about the features of ADHD. So to begin with, the child is usually very hyperactive and the child is not able to pay that much of attention, maybe during the class if the child goes to a school. So the child is unable to pay that much of attention that is required. If a child has to attend a class for 45 minutes on, like it is an online class or a physical class maybe, so the child will only be able to give the attention for 5 to 7 minutes. That too when the child has that potential to maintain that kind of concentration in any topic. So number one is lack of attention. Then the child will be very hyperactive. The child will not be able to sit at a particular place. Attention is another thing, and inability to sit at a particular place is another thing. If you ask your child to sit at a place and perform a particular activity, the child may not be able to do that. Maybe you give him an activity and he will be just busy only for 2 to 3 minutes. Then he will have some distraction in mind and he would just get up of the chair and just indulge himself or herself in any other activity. So this is one thing. Then other is the child may be daydreaming all the time if the child is underactive. If the child is underactive, the child may show you lethargy, the child may show fatigue, the child may be showing tiredness kind of behavior all the day. So whenever you are asking a child to perform any kind of activity or any studying thing or any games or things like that, so the child will not be able to sit at a place and just complete the task, because the child will be lost in his or her own world. He will always zone out. If you're trying to explain something, if it is a book, if it is a story book, if it is a lesson of any academic book, so the child will be lost in his or her own world and will be zoned out, will be not able to listen to your words, to be specific. And other thing is the child will be trying to gain your attention all the time. There are children जो हमेशा एक attention seeker की तरह behave करते हैं. वो आप जो बोल रहे हो उस पे ध्यान नहीं देंगे, but वो अपना एक attention seek करने की कोशिश करेंगे by doing any random stuff. If you are trying to just do your work and you are not busy with the child will not be able to accept the fact that father or mother is not available with the child at that particular moment. So the child will do some kind of random stuff to just grab your attention and to just make sure कि आप उनकी तरफ ध्यान दें अपना काम छोड़ के. So this is the thing that children with ADHD do usually. And the other thing is, most importantly, the child will be very easily frustrated. The child will show temper tantrums, बहुत जल्दी गुस्सा होना या बहुत सीरियस सिचुएशंस में हंसना, unnecessary laughing, unnecessary smiling, all the things like that. तो इमोशनल रेगुलेशन बहुत imbalanced होता है ऐसे बच्चों में. Yeah, and also the child may tend to forget things very easily. Unintentional forgetfulness बहुत ज़्यादा common हो जाती है when a child is having ADHD. Then other thing is that the child will be very impulsive. If you are playing any game which has turns involved, like Ludo maybe or Carom maybe, So the child will not be able to wait patiently for his or her turn. Whenever his turn is not there, he might not be able to wait patiently to play the game next. So patience level बहुत कम होता है. The child is not able to tolerate that kind of waiting duration. So हर काम में बहुत जल्दी उसको impulsively fulfill करना, अपनी turn आने का wait ना करना, then बहुत abruptly answer करना. If, for example, if a child is studying in a class and the teacher asks a question to a group of students, so that particular child will not be able to wait for his or her turn, or he might not know the concept of raising his hand and then telling the answer. But the child will be very impulsive and बहुत impromptu answers करना becomes very common in children with ADHD. Then there are few children who also suffer with a little sensory issues. And when we talk about the sensory issues, it can be either hypersensitive or it can be hypersensitive. When the child is hyposensitive, that means the child is trying to seek all the senses. The child becomes over responsive. Whenever you are giving any stimulus, that is not enough for the child. तो वो एक छोटा सा stimulus भी उसे बहुत ज़्यादा amount में चाहिए होता है. So then we say that the child is hyposensitive. That means the child is seeking that sense. And on the other hand, there is a concept of being hypersensitive. The child will be very defensive towards any particular sense, maybe touch, maybe vision, maybe audio, maybe anything. It can be on any sense. So as we talk about the senses, there are total 8 senses that we talk about. I will just link the video here which explains all the sensory mechanisms, so you can just watch that. And yeah, so coming back to the hypersensitive thing, the child will be defensive. छोटा सा stimulus भी child के लिए बहुत ज़्यादा stimulative हो सकता है, and the child will not be able to take that. So there are two categorizations, and there are children having ADHD and also they have a little sensory issues in them. So that is another thing. Okay, so coming on to the last part of the video where we talk about the relation of the child with family, relatives or friends of same age group. So the child will not be able to maintain that peaceful relation with other people of the family, maybe neighbors, relatives or friends, neighbors or anyone. The child may tend to kick or hit the other children of the same age group or younger than them, because children suffering from ADHD, not every child, but yes, there are children who become a little kind of they have that dominating nature in them, जिसकी वजह से वो अपनी से छोटी एज के बच्चों को बुली करना स्टार्ट कर देते हैं. दे माइट बिकम वेरी अग्रेसिव ऑन देम. उनको मारना, हिट करना, किक करना, बाइटिंग इज वेरी कॉमन. सो दिस कैन बी ऑल्सो अ केस व्हेन द चाइल्ड इज नॉट एबल टू एडजस्ट with the children of same age group or younger or adults maybe, and अपनी family के अलावा they are not able to maintain that peaceful relation with others. अपनी family में भी the child may be close to father or mother, but it is not same all the time. The child may have this changing kind of a behavior with other people surrounding the child. So these were the very few features that we talk about in ADHD. If you want to know any more features or you have any query related to all this, you can just mention it in the comments below, or you can send a direct email. I'll mention the mail ID where I can send you a complete checklist for ADHD and you can just have a look at it and gain your knowledge. So that's it for the video. I hope this video was informative for you. If it is, do share it with your friends and do subscribe to my channel. Thank you for watching.